All right, so we are getting started. Thank you to everybody who is tuning in on tonight's webinar. Very excited to introduce this topic on the webinar series and to introduce our sponsor and some of our partner products. So someone who is tuning in live is going to win some swag, which is always fun. With all of EBFA's webinars, they are recorded. So if you happen to miss something or you want to hear it again, you can catch it on, can be funny, catch it on EBFA's YouTube channel, which is ebfafitness.com, youtube.com/EBFA Fitness. That's where you can catch all of our archived webinars. It's also on the Facebook page and our actual website. So we are going to jump on into it because there's a lot of information and I want to respect everybody's time. So real quick note that this is a webinar that we are doing in conjunction with Somatic Senses out of Vancouver. They are hosting EBFA's Barefoot Training Specialist Level 1 coming this March 11th, 12th in Vancouver. So if you are interested and you are from the western side of Canada or western USA or from anywhere in the world and you want to go to Vancouver, they're hosting our Level 1 certification. Great education coming out of Somatic Senses. So please do check them out. Please do sign up for our Level 1 certification. If you are new to EBFA's education and kind of the underlying concepts of how we build our programming, this webinar is going to be a great introduction into the belief systems and the concepts through which we put across our programming and how I truly look at my patients. So, as we get started, briefly introducing myself. My name is Dr. Emily Splichal. I'm a podiatrist and human movement specialist. I am a practicing clinician, but I'm also an educator and a fitness movement professional. I'm the founder of the Evidence-Based Fitness Academy, which puts out different certifications, including our Barefoot Training Specialist, which we have a brand new Level 3 that's launching this year. So that means you can continue to expand off of concepts that you've learned through EBFA. In addition, we have our Barefoot RX certification, which is focused much more on the rehab professional, whether you are a physical therapist, a chiropractor, Pilates instructor, or you're just a fitness professional, not just, but you're a fitness professional who focuses on corrective exercise and really wants that in-depth, detailed information on certain injuries. So we do go into different differential diagnoses for foot injuries in our Barefoot RX program. I am also the inventor of Naboso technology, which is the first ever small nerve proprioceptive surface. I will talk about that in the end. Please check it out. It's super exciting. We're launching that just this year. And then I'm a consultant for Nike. All of our information can be found on ebfaglobal.com. Okay, so our partner products. This is some of the swag that you are going to win. One person is going to win, so make sure that you are on point here. We have a rad roller, some toe socks, and correctos, in addition to a very beautiful Benetton duffel bag that is embroidered with the EBFA B logo. That's going to be going to one lucky winner. All right, getting started. So we are talking about foot-to-core sequencing during human locomotion and why I like looking and breaking down the demands of human locomotion or the gait cycle, walking, bipedalism, call it what you want, is that there are very unique demands that are required for ambulation. If you can understand and build those demands into your clients, athletes, and patients' programming, you're going to get much better results and decrease the risk of injury, even if they're focusing on running, dynamic movement, change of direction, etc. We still want to go to those innate natural demands of human locomotion because that really was the first closed chain movement of our neuromuscular system. So I like to go back to that. I like to use foot to core sequencing built into my gait retraining, if you want to call it that, because we know that the only contact point between the body and the ground is the foot. That way, or therefore, there's a lot of very important proprioceptive fascial integration that's led from the ground up. And that's what we want to be focusing on. So there are 3 demands when it comes to the foot. And I try to use these demands when I'm coming up with exercises or trying to educate professionals about exercises that they may choose to make their clients foot strong or barefoot strong. A lot of people are doing different agility drills with their toes, toe gymnastics, call it what you want. But you really want to ask yourself, are the exercises that you're choosing for the foot translating to one of these 3 functions, where these 3 functions are going to translate directly to human locomotion? That's my goal with my patients. We only have so much time during the day, so I want to hit the most effective exercises. They might not be exciting. They might involve a lot of short foot. However, you want to have that direct transfer to our true function. Those 3 demands of the foot are single leg balance, the dampening of impact forces, and propulsion, or the ability to lock and resupinate the foot so that you can become a rigid lever. Those 3 are the demands of human locomotion from the ground up, from a foot to core perspective. And that's what we want to be focusing on. So first one that we're going to focus on is going to be single leg stability, single leg stance. And this really, I did a webinar, I don't know, several months ago on lumbar lordosis and the evolution of human locomotion and bipedalism. And a key feature in the evolution of human bipedalism was changes in our pelvis from the primate pelvis. And when you look at a gorilla or a primate walking, there's a key differentiating features between the way that they walk and the way that we walk, or the current day man walks, where the stride length is much greater in how we walk, the speed, the efficiency. We are able to be in a more single leg stance position because of the shift in our pelvis. So I'm going to switch here. One of the key things that happened in the evolution of today's pelvis is that our ilium rotated posterior. So you now have a lateral rotation of the pelvis, which shifts the function of your glutes. If you look at the pelvis on the right and it's facing directly posterior, you can see that the glutes, the primary function of the glutes, would be in extension, because if you're directly posterior, you are now in the sagittal plane, you are owning hip extension. If you are in a quadrupedal position, that makes sense. However, as soon as you get upright and you're going to meet the demands of ambulation and human locomotion, you must be able to own the lateral line or the frontal plane of your pelvis. And that's how you're going to own single leg stability or single leg stance. So that rotation of the pelvis allowed for the shift in function in your glutes to not only be a powerful hip extensor, but to own frontal plane stability, hip abduction, or the resistance of hip abduction, and then the stability in that single leg stance. So the lateral line of what we're focusing on here, because we want to bring it back to the foot, is going to be focusing on powerful fascial connections that exist deep within the foot. We know that our lateral line, if I go back to this slide here, we know that our lateral line, TFL, glute med, IT band, comes down into your perineals. Your perineals, focusing specifically on peroneus longus, crosses the bottom of the foot. If we can see in this picture here, crosses the bottom of the foot, it's going to insert onto the first metatarsal, or you could call it the first ray, which we're going to talk about other demands of the foot and ambulation, but it inserts onto the first ray. That shift in the peroneus longus is critical to single leg stability. Your lateral line, starting with your peroneus longus, actually connects to another very important muscle called your posterior tibialis, which comes on the medial side of the foot. Your posterior tibialis is part of your deep front line, which connects your foot to your core from a local reflexive deep stabilizing perspective. So I like to think about deep front line as your local stabilizers, thinking more close to the skeleton, more finite, faster pre-activation type contraction would be the deep front line. And we focus on this heavy in the BTS program, whereas your lateral line, which is talking about your gross pelvis stability, so the actual abduction of your pelvis, would be more of a gross or a global type of muscle stabilization. You always want to remember that local comes before global. So when it comes to single leg balance, you want to feed it from the ground up through your deep front line and that fascial integration that exists between the posterior tibialis and your peroneus longus. You can actually get faster perineal activation if you have stronger intrinsics within your feet. What that means is that intrinsics is another type of local muscle. So local precedes global. If your foot is stronger, you're going to activate your deep front line faster. You're going to get that foot to core connection through which now your global lateral line can activate. You are going to be much more stable in that single leg stance position. The way that we activate the deep front line, and if you've taken many of my webinars, you've heard any session, you must know short foot. If you haven't, somehow you blinked out that part of it. But short foot activation is the key exercise that I use to activate the foot and the core. And that's huge. We do not want to think about short foot as just a foot activation exercise. We want to look at short foot as a way to activate your foot to core stability or your foot to core sequencing. A strong foot that's not connected to your core does you no good. You need them to be speaking to each other because we are global beings. We need to always think about our integrated global function. So if you're new to short foot, I'm going to talk you through it. If you're well adept at short foot, we'll just breeze through this. So when I teach short foot, I always teach short foot 1 foot at a time. Reason for that is when you're doing mind-muscle connection to someone who's very disconnected from their foot, it's going to be difficult for them to engage short foot, both feet at the same time. So if you're doing this now, you can shift into a single leg stance. Your opposite leg can be still down, kind of in a kickstand position. You don't have to be in a full single leg balance. You want to bend your front knee, which means you want to unlock your foot. What's interesting is that when you do short foot, you create a locking mechanism up your lower extremity. So if you lock a locked joint, you can create shear on your knee and irritate the meniscus. So please be mindful of that. You always want to keep a soft knee. Okay? You want to make sure that you're finding your foot tripods. You're underneath your first metatarsal head, your fifth metatarsal head, and your heel. Or you could focus on spreading and placing your body weight underneath your big toe, your fifth toe, and your heel. You're spreading your digits, you're placing them down onto the ground, and before you even engage short foot, what I want you to do is engage your pelvic floor. To engage your pelvic floor, I like to cue pelvic floor to start from your posterior pelvic floor. So I want you to stop your poo, lift your perineum, or draw your anterior posterior aspect of your pelvic floor together. If you're thinking of your pelvic floor like a face of a clock, and your pubic symphysis is 12 o'clock, and your tailbone is 6 o'clock, you would be drawing 12 and 6 o'clock together. That's how you would start connecting anterior posterior pelvic floor. Okay? Or you could stop your poo, stop your pee, and then you would release it. Okay? So we're in our position. We're going to engage our pelvic floor, stop your poo if you want, stop your pee, engage that, hold that, and then push the tip of your big toe down into the ground while holding your pelvic floor engaged. Feel that connection, and then just let it go initially. Again, same thing. Assume the same position. Engage your pelvic floor, posterior, anterior, hold it, push your big toe down into the ground, and then let it go. And then you want to just get into the coordination of how that feels. You can do right side, left side, and then you want to start adding into the time. So you would want to hold that for 10 seconds, release it, switch to the other side. That's how we're activating initially. We then want to start doing this in a single leg stance, which is going to activate your lateral line. So there's a series of different exercises that you can do on a single leg involving short foot, foot to core exercises. All of these exercises are found on the EBFA YouTube channel, youtube.com/EBFA Fitness. Click underneath the playlist, Run Injury Free. You will see a series of exercises, but there's a series of single leg exercises, such as what I'm doing here, a single leg deadlift. So while I'm in this position, I'm connecting through my big toe. You're going to have a lift of your arch. You're going to have my knee slightly bent, go all the way up. I'm engaging my pelvic floor, specifically my posterior pelvic floor. So I have that connection. And then when I bring my chest up to come out of the deadlift, I'm going to initiate it through that foot to core connection. So if you could say that your foot to core connection when you're in the down phase of this deadlift is, let's say, a 1 out of 2 connection. And then when you come out of that deadlift, I want you to bump up that activation to a 5 or a 6, if that makes sense. And then you would exhale as you bring it up and then resume. 1 out of 2 tension, down to the bottom phase, kick it up, 5 to 6, up out of the out phase, you're bumping it up, and then you're going to go back down. So you're kind of getting this rhythmic activation pattern through your foot to core sequencing. Because we're on a single leg, we're going to be activating the lateral line as well. But we're activating the lateral line from the ground up through short foot and the deep front line. Okay? Next demand that we want to think about is the damping of impact forces. And the damping of impact forces is very important. To understand how your body damps impact forces, we need to understand how your body perceives impact forces. And the better that you can perceive these impact forces, you will then be able to more effectively load and unload them in a very rhythmic way, thereby reducing your risk of injury. Remember that most of the injuries that I'm seeing in my office is happening from the day-to-day of their activities, which means they're walking from point A to point B, and somehow they're breaking down with the repetitive loading and unloading. Shorter distances, fine. What's interesting, I saw a patient today who had recently moved to New York, and I get the advantage of seeing patients in a city where everybody walks. So I get to see a lot of patients who are who have recently moved to New York, and then they all get foot pain because they're not used to walking that much. And New York is a walking city, and you're walking on concrete. So it's not that they are not able to load and unload, but in the demands of the city, in the repetitive way, where most people, many of my patients, I ask them how many steps they're taking a day. Average that my patients are seeing is probably 15,000. So that's a lot of repetitive loading and unloading that your nervous system has to be able to do from the ground up. So very important thing to understand how your body perceives those impact forces and then how your body effectively loads those impact forces. So if we take a look here, average is 5,000 to 8,000 steps a day. Many of you may take more. Many of my patients take more than that, between 12,000 and 15,000. So that's a lot of steps. Every time we take a step and our foot strikes the ground, we have 1 to 1.5 times our body weight in impact forces. Now, this can definitely vary. It can vary based on your body weight. It can be based on your movement pattern or the surfaces that you're walking on. However, that would be the average. What's also important to note is it's not just the degree of impact forces coming in, but it is the rate at which these impact forces are coming in. When we walk, impact forces are entering your body within less than 50 milliseconds. In my BTS workshops, I speak about how fast twitch muscle fibers don't reach their peak contraction to around 70 milliseconds, which means when you're thinking about the loading, reflexive loading of impact forces, is you cannot be in a reactive state during ambulation. If you are walking, striking the ground, sensing the impact, and then reacting, it's too slow. You're already into the next step, that you're not going to be effectively loading and unloading those impact forces or that potential energy. When it comes to impact forces and how we perceive them, this is very important. We perceive impact forces as vibrations, and these vibrations are detected through the small nerve receptors of the skin in the bottom of the foot and your fascia. So the better that you can perceive these vibrations, the more in tune you will be with the impact that's coming in. Where you could see this as it relates to footwear is if you put cushion in your shoes, that cushion is going to damp and take away those impact forces, or your ability to perceive those impact forces. And that's usually where you get a mismatch between impact coming in and your loading response. That's where injury results. Impact forces are used as elastic energy for your next step. To effectively use impact forces for your next step, you have to effectively load them. If you are not able to load them effectively, obviously you're going to start to injure yourself, whether it's through a stress fracture, plantar fasciitis, Achilles tendonitis, etc. So as I had already mentioned, the detection of impact forces is coming through the bottom of your foot, through the small nerve receptors, through your fascial system. So you want to be in tune with the vibration that's coming in. There is a theory that's called the muscle tuning theory. This is based on Dr. Nig's research, and it has to do with how your body perceives vibrations and how your body damps those vibrations. And it's the accuracy of your perception and your loading response. That match allows you to then create an appropriate response. So muscle tuning theory, what we're going to look at here, is your body perceives the vibrations. The way that your body is going to stop the vibration is through isometric contractions. These isometric contractions start with your foot. So they start with the compartments in your foot. We have 9 compartments in our feet and 4 compartments in our lower leg. Those compartments play a very important role in the stiffness that we're able to create with our foot and the stiffness that we're able to create in our lower leg. Okay. Oops, so sorry. Just checking. Someone had lost sound. I apologize. So your ability to create that stiffness is going to be important. So when you create an isometric contraction, then you increase the compartment pressure, but you also increase the compartment stiffness. So you need appropriate stiffness, foot and ankle stiffness upon foot contact in order to take those impact forces. Once you have appropriate isometric contraction or fascial stiffness or compartment pressure, you are then able to load and unload the potential energy through your fascial system. Now, what's interesting is that this muscle tuning theory and the isometric contractions of loading impact forces is happening before your foot is even contacting the ground. That is called pre-activation, and that's extremely important. Is you have to be in a pre-activated state. What happens when we put on our shoes is that we become inherently slower. So taking off our shoes and strengthening the feet from the ground up plays a very important role in how you're able to pre-activate the foot. So if we look a little bit further at that foot to core integration from a pre-activation perspective, it's going to be linked to your plantar fascia. And I did a webinar recently on your plantar aponeurosis, or your plantar fascia, and the fascial integration of the foot. This is key. Most of the fascial stiffness and integration from your foot is rooted back through your plantar fascia, your plantar aponeurosis. So your plantar aponeurosis is part of your superficial back line. So if we look at the next slide, your superficial back line is going to go all the way up into your hamstrings, which inserts onto your sacrotuberous ligament. Your sacrotuberous ligament plays a very important role in the stabilization of your SI joint. Your SI joint of your pelvis plays a very important role in the way that force is transmitted through your pelvis. the transmission of force through your pelvis is important in decoupling and ensuring that impact forces are not going really all the way up into your brain. So you have to decouple them and make sure that force is being transmitted or damped throughout these checkpoints in your body. These key checkpoints is going to be foot and ankle stiffness, SI joint stability, or the nutation of your pelvis and your SI joint, and then it's going to be through decoupling of your thoracic spine and the counter rotation of your T-spine with your pelvis with every step that you take. And you can see that on this guy here, is that you have opposite leg swinging forward with the opposite arm. That is creating a decoupling, but what's also happening here is that the right leg that's swinging forward is in a pre-tense state. So the foot and ankle stiffness is already present before that heel is contacting the ground. Because your plantar fascia and that deep fascial integration of the previous slide here is linked to your hamstrings and to the sacrotuberous ligament, you are then going to create stability of your SI joint for that initial impact peak. So that's going to be a key element of foot to core integration as well. If we look at the third demand of the foot, which is going to be propulsion, or the ability to become a rigid lever, this one is also key. Key. And I just did a webinar on this as well, focused on the science of the human lever. Fascinating aspect as far as biomechanics, but also fascial tensioning. The human lever, if you can see the foot of this dancer on the right side, has certain key features that we need to be able to optimize. These key features is an inverted locked stable subtalar joint, elevated arch, which means that your navicular is lifting. The muscle that inserts onto your navicular is your posterior tibialis. So key function of your ability to become a rapid rigid lever is going to go back to your posterior tibialis. So if you remember from the other slides, your posterior tibialis is going to be linked to your deep front line. So your deep front line and that deep local stabilization is going to translate not just for single leg stability, but it's going to continue through your ability to become a rigid lever and then to transfer forces to take the next step. Other important feature of your human lever or your foot lever is a stable MPJs or that lever point. Dorsiflexion of the MPJs is happening. You have forefoot splay, which is a mechanism of fascial stiffness and proprioceptive stimulation. And then you actually have a deeper fascial stiffness that is existing. So important key here is the rate of resupination or the locking of the foot. So you want to be able to resupinate and lock the foot. This is linked to your posterior tibialis. One of the best exercises for your posterior tibialis is this picture on the left. If you take a ball and you place it between your heels and you drive your heels together and you're doing, let's say, a heel raise, but you have the ball between the heels and you're engaging your heels throughout, then you're going to have higher posterior tibialis activation. The way that I actually like to do this is technically considered a short foot exercise. So if I had to choose a foot exercise that would be the king of all foot exercises, I would say it's this. Not short foot. This is a form of short foot. So this variation of short foot is going to have the highest functional transfer. So again, you have the ball, take a lacrosse ball, take the rad roll, especially if you win the rad roller, you can take that one, buy a rad roller, put it between your heels, and what you're going to do is slightly lift your heels, drive the heels together. That in itself is emphasizing subtalar joint inversion. As you lift your heels into the heel rise, I want you to focus on pushing your digits down into the ground. So you're not just balancing on your met heads, lifting your heels, doing a calf raise and squeezing a ball. As you lift your heels, you are pushing your toes down into the ground to get that digit activation, which is actually linked to your plantar fascia and is linked to your fascial stiffness. And then you're obviously timing this with your breath. So we're going to look real quickly again here as far as your plantar aponeurosis. Some of the key features of your plantar fascia or plantar aponeurosis is that this is, again, the root through which all of your fascial stiffness comes from. It's part of your superficial back line. It translates further into the forefoot. We can see this beautiful anatomy here. There is your medial central lateral band of your plantar fascia. As it comes distally into your digits here, it's going to split into 5 slips. Those 5 slips insert onto the base of the proximal phalanx, or onto the digit, and it becomes what's called your plantar plate. These plantar plate extensions are the primary stabilizer of your MPJs. Again, key feature, the key demands of being a rigid lever is that you must have stable MPJs. Primary stabilizer MPJs, plantar plate. So this is your plantar plate. What's happening here, the picture on the left, this would be almost how I'm saying that when you do the ball between the heel and do the heel raise, push your digits down into the ground. Feel and connect to the ground when you're pushing off. We need to have an action that's going into the ground as we're pushing off. Your energy cannot just go up. You have to have energy that's going down. The stronger that your digits are pushing down into the ground, the more power you will actually be able to produce. And there's some interesting research that looked at acceleration and vertical jump related to stronger toe flexor strength. Really what helps or assists that toe flexor strength is your plantar fascia and your plantar plate. When someone loses the integrity of their plantar plate, which is their plantar fascia, they start to lose purchase of their digits. So you can see how this toe is floating here. They have lost purchase of that digit, which means they've lost or they have an energy leak within their plantar fascia or their fascial stiffness of their foot. Any of those energy leaks are going to lead to subtle compensations that can result in injury. So what's interesting here, this is going to relate to forefoot splay, which again translates to propulsion and the ability to become a rigid lever. When we look at our plantar plate, if we go back here, your plantar plate, there's a small little slip, if you can appreciate that. That's going to become, and right here you can see these different structures here, that you can see that there is your deep transverse metatarsal ligament. This is continuous with your plantar fascia. Your plantar fascia, plantar plate, deep transverse metatarsal ligament is fascially integrated. What your deep transverse metatarsal ligament controls is what's called forefoot splay. Your ability to splay or not splay your forefoot translates to stability and fascial stiffness of your lever at push-off. So something that we want to think about. Your average forefoot splay in the foot is 3 millimeters for women, 5 millimeters for men. If your shoes are restricting forefoot splay, you are going to lose some of that proprioceptive stimulation coming from your deep transverse metatarsal ligament, your plantar plate, into your plantar fascia. You require forefoot splay to stimulate or to continue sufficient fascial stiffness of your foot during push-off. I hope that makes sense. So that's why shoes can lead to a lot of compensations that we don't even realize, and really what they're messing up is the innate fascial architecture of the human body. And that's why I'm so much in favor of barefoot movement, but I'm also in favor of natural footwear that allows splay, such as Vivo Barefoot, Vibroms, etc. Is you want to allow the ability to not just have impact forces transferred, but to have that fascial proprioceptive stimulation to continue through the push-off phase of gait. So as we look at the summation and how we can translate this into programming for our clients is remember that sequence of events. If we look here at the human gait cycle and we have heel strike into, this is going into loading response, mid stance, late mid stance, push off. So those are going to be your 5 phases of gait. You really want to always be thinking of the foot to ground relationship, and then appreciate that your foot is not an isolated structure. Your foot is neuromuscularly and fascially connected to your core, which is your center of stability and your center of power. So your base, being foot, needs to have a very rapid, pre-active, reflexive connection to your base of stability, i.e. core. And this is happening in continuum throughout the entire gait cycle. So really it needs to precede that. It should really be happening here, is where your pre-activation is happening before your foot even hits the ground. That's where you need to be initiating fascial stiffness, foot and ankle stiffness. That's going to translate on this left side all the way up into the SI joint and that stability of the pelvis and the nutation. And then as we translate forward, because we've already initiated that fascial stiffness, by the time we are in single leg stance or single leg stability, you are already into your local stabilizers that your global stabilizers have no problem activating. And then as you translate further into the push-off phase here, you have that continuum of fascial stiffness that now you are very, you're able to very rapidly relock and resupinate the foot for push-off. And then it happens again, and then again, where you can tell people who are working against the natural loading and unloading of their fascial system, and that the way that they move is in a very labored way. If it takes energy to walk, and it's not just exhausting, but you're working almost against that fascial loading and unloading, that's where injuries occur. And helping your clients or your patients understand that walking is rhythmic, I think that's one of the most important things. Fascial fitness is key to understanding that. I'm a huge fan of gyrotonics, gyrokinesis, opening up the spiral movements of the body. Obviously, body weight movements, barefoot foot core activation is a key principle that's going to translate into more effective human locomotion and movement efficiency. So before we jump into questions, we're going to go into our swag bag with rad roller, correct toes, toe socks, and the B bag, which is a Benetton duffel bag. When we walk, counter rotations between the T-spine and pelvis decouples impact forces and allows our eyes to remain, so oops, I totally did the answer, remain stable. At what thoracic vertebrae does this decoupling occur? Somebody already guessed it. What is the answer? If you type it in, where is this decoupling happening? Between the T-spine and the rotations of your pelvis. I gave you the answer already if you saw it. Otherwise, someone had guessed it before I had finished. That decoupling is happening at T8. So that is where you want to have peak rotational freedom of your T-spine to allow the decoupling of impact forces and the spiraling from the pelvis all the way up. That decoupling is a critical element to keeping your eyes stable and making sure that the head-eye is stable when you are walking. If you start to lose T-spine mobility, obviously this is where things translate a little bit higher up and the body starts to lock down, and again things become more labored. So any of my patient who has foot pain, gait imbalances, all of them are focusing on thoracic mobility as an element of their gait retraining, quote unquote, I'm saying that. Okay, so as we go into some questions, if you have questions, just type those in. I know that some people were losing or possibly losing some sound when they go in and out. So just know that this is recorded. It's going to be archived. I will be sending it to everybody who signed up for this. You'll be able to listen to it again. And then it's always also found on our YouTube channel. Before we jump into any questions that people may have, I want to talk super briefly about Naboso technology, which is our small nerve proprioceptive surface. There are several products that are out. First product is our yoga mat or exercise mat. This is a standard yoga mat size. However, it does not have to be used just for yoga. It can be used for any barefoot exercises. 5 millimeters in thickness, 4.5 pounds. It has a patent pending material on top that is stimulating texture. It allows vibrations to be transmitted, appropriate vibrations to be transmitted, skin stretch, pressure, small nerve proprioceptors. So you will actually see an improvement in your foot to core activation using Naboso technology and doing the exercises that we spoke about on the yoga mat or on the Naboso mat. We also have Naboso flooring, which we're launching beginning of Q2 2017. So that's going to be beginning of April. We're going to be launching that. And then shortly after Chinese New Year, which is happening right now, we will be having, super excited to announce, Naboso insoles, which means that you will be able to bring small nerve stimulation into your shoes, allowing your clients, your athletes, patients to get that important proprioceptive information, even if they're in a shoe, which innately deactivates the foot. So we're super excited about that, and there's amazing research related to textured small nerve proprioceptive stimulation insoles. So more to come on that soon. So as far as any questions that you may have, all right, question here from Damien. When doing short foot, you want to neither invert or evert. When you are on a single leg flat position, when you do short foot, because you're activating your plantar fascia, you're activating posterior tibialis, you're activating abductor hallucis, all of those muscles inherently invert your subtalar joint. However, you're not going to be able to see a massive inversion. It's not going to throw your client onto the lateral side of their foot. So just know that it is a inversion moment, we could call it, that is directed into your subtalar joint. So it's a way to make your foot more stable. You should not be everting. You should be in a neutral position. Let's say your client starts out in a very pronated, say they're overpronated. I will always neutralize their foot, so I'll derotate their tibia, lift their navicular, so I'm essentially doing what orthotics do, but I'm manually doing it and telling them to hold that position, now engage short foot. So you want to think that it doesn't really do us too much good to be doing short foot in a overpronated, unlocked position. We want to at least be neutral, and then your body will shift you from neutral into a inverted, stable position. Okay? So, good job on the guesses. Whoever guessed T8, good job, good job. Okay. Chris, you cheated then. So we will have to question that ability to get the prize. So how do you assess pre-activation? So that's a very good question. Pre-activation from a quantitative perspective can only be done through EMG because you're looking at the timing of where that muscle activation is. If you do not have an EMG system, many of you may not, totally fine. And then I would go based on make your cueing conscious. So pre-activation is something that becomes pre-programmed in your nervous system. So it's not something that, and you're not going to constantly have your clients on EMG, but you are able to tell in the control of the movements. If you ever look at your clients moving with a high-speed camera, you would be able to capture and see that they have better control of, let's say, a knee valgus angle. Just saying that. or they feel the sound of their movements is less. You don't hear them hitting the ground hard. When they're in a pre-active state, they don't feel a sudden impact that goes into their knee joint. So some of it's going to be perceived by the client, and then some of it would be you looking at the control of their movements, or it would be on an EMG. So as long as that helps. Okay, so if you have thoughts on proper first MPJ extension, how much functional range do you look for? Do you target extensor hallucis brevis rehab? Great question. So with the first MPJ dorsiflexion, now kind of textbook answer would be you need ideally 65 to 75 degrees dorsiflexion in your first MPJ. That's ideal. However, the minimum would be 30 degrees. So if you have at least 30 degrees of dorsiflexion of your first MPJ, you will be able to walk. Does that mean you'll be able to jump and do crazy lunges? Probably not, but it's enough to walk. The way that I assess is you can have them stand, put the foot in, have them in a relaxed position, and if you can easily put your finger underneath their big toe, so you can lift their big toe, that's a way to assess. You can move the joint open chain, although that's not going to translate to closed chain necessarily. And then third would be to do a gait assessment and look at their push-off position. With those three things together, you're able to conclude. Simply doing an open chain is not going to translate because the movement is the foot moving relative to the big toe, where if you move the big toe relative to the foot, that doesn't necessarily translate. As far as focusing on the extensor hallucis brevis, there's not any of that is going to be directly anecdotal. I actually don't focus on that at all because the way that we get over our first MPJ, or we dorsiflex the foot during gait, is that you have to stabilize what's called the first ray. If you cannot stabilize the first ray, which is done by your peroneus longus, then you're going to jam your first MPJ. So proper mechanics during ambulation to get over your big toe has nothing to do with extensor hallucis brevis strength. The toe is not pulling it up. It actually has to do with flexor plantar intrinsic stability, posterior tibialis, and peroneus longus. That balance is much more important because you have to remember that your toe stays fixed and your foot moves relative to your toe. If it had to do with extensor hallucis brevis, your foot stays fixed and your toe moves relative to your foot, if that makes sense. So I would focus that. All right, I will add some references to the PDF for those who want the PDF with the references on them. Then please send me an email to education@ebfafitness.com. We'll include that bibliography so then you can check out more of that as well. Okay, so we will go over 2 more questions, and then there are many questions. So I'll try to run through these very fast. What is the best posterior tibialis exercise? That is the short foot and ball between the heel short foot exercise. Those are your go-to posterior tibialis exercises. MPJ stands for metatarsal phalangeal joint. That would be your big toe joints or all the little joints of your foot where you're going to shift your body weight through. If a patient believes that the only way to have pain-free gait is to wear orthotics all day, every day, how would you respond to them? I would say I would first get them a proper foot assessment and determine their foot type. If they happen to have what's called posterior tibial tendon dysfunction, or PTDD, which is of a severity of grade 3 or grade 4, which if you just Google those, you'll see exactly what I mean. They have lost some of the mechanical stability of their foot, which means they really do need to be in orthotics. So that would be one of the exceptions to the rule, is that they need that for that stability, because they're just going to completely sublux their talonavicular joint if they don't have that orthotic. Let's say they have a neutral foot and they're, you know, addicted to their orthotics because someone told them they had flat feet. That's a different story. Then what I typically do for those patients is I have them start doing myofascial release to the foot. Whether you're standing on a golf ball, you're rolling on a rad roller, you want to be doing daily foot release to then, or even before their workout, if you're doing it in that sense, to then wake up the foot and then go right back into their shoes and then start to see how they feel. After they get used to that, then you release the foot and then do 5 minutes of short foot, right? And then go back into the shoe. And you start to have them recognize for themselves the importance of foot activation, foot myofascial release. Even if they're staying in the orthotics, they still need to do this. So it's a way for them to understand that the orthotic is not a magic insert and that they still must recover this tissue. So any input on the breathing, the activation of short foot on the up phase of any exercise is where we are exhaling. So we are definitely taking the diaphragm and the pelvic floor rhythm into cue, knowing that as we lift the arch of the foot, you want to time that with your pelvic floor. If you want to take it from a yoga perspective, you're essentially stacking your bandhas, that the activation of the foot matches the activation of your pelvic floor, and you have mula bandha and pada bandha that are linking together, and that translates to stability. So exhalation, typically on the higher exertion of short foot with pelvic floor. So, all right, let's see if there's one more that's kind of pseudo easy. Not easy, but quick. Last question on shin splints. And then if you have any questions that I was not able to get to, please send me an email at education@ebfafitness.com. Again, if you want the PDF with the bibliography, email me there, and then check out the recorded archive, which will be on YouTube and emailed to you as well. Last question. If my client is suffering from shin splints from past marathons they participated in, that means that they have fatigued the repetitive loading and unloading of impact forces, because it's running, it's happening at a higher, faster rate. That most likely means that they were fatiguing that isometric muscle tuning response that I described. If you have a delay in your muscle tuning contractions, you actually have decreased compartment stiffness, and then your bones are able to bend under force. So shin splints or medial tibial stress syndrome is actually a bowing or a bending of your tibia. What you can use, and something that I use in a lot of my patients with shin splints, is compression sleeves, compartment compression sleeves, the lower leg sleeve. And what that does is that increases your baseline compartment pressure, which means that the muscles don't have to work as hard because they are already at a higher compartment pressure at baseline. So the need to activate super fast isn't as high with the sleeve versus without the sleeve. So it's a very good way to use this theory of vibrations, isometric contractions, muscle tuning theory, stiffness for your shin splint patients, using all of the exercises that we spoke about, but also using the compression apparel, specifically that lower leg sleeve, and how it works from a neuromuscular perspective. That's a very, very good question. So, all right, super fun. I hope you guys enjoyed. The next webinar that I'm going to be doing, which will be most likely the end of February, as I'm traveling for the next 3 weeks, is going to be on surface science, and I'm going to be showing some of the research around textured insoles, which when it comes to not just seniors and fall reduction, but athletes, and the rate at which they can perceive ankle inversion is fascinating. some of the research is if you wear textured insoles and you stimulate your proprioceptors when you're just walking around, not even doing your sport, that in itself even translates to faster ankle proprioception in your sport, which is super cool. Super, super cool. So stay tuned for that. We announce all of that through our mailing list as well on Facebook and social media. Thank you guys so much. Have a wonderful day or night, depending where you are. And I will see you on another EBFA webinar.